back again to discuss about wound care. Well, we have so high rates of wound care patients in our agency. That's the reason why we're focusing on this one too. Assessment and observe the wound characteristic, which includes the description of wound bed, measurement, the type of wound and the stage, the drainage, and the signs and symptoms of infection. Your intervention is to provide wound treatment per physician's order. If the wound status changes, request for a new wound treatment. Document the wound treatment under the skilled intervention section of this visit note. Call physician within 1 calendar day if there are signs and symptoms of deterioration. Instruct the patient on signs and symptoms of infection when to report to the nurse. Remember this, the patient should own to their disease condition. If they don't own it, they will not participate in this matter of teaching and acceptance. If signs of infections are present, call the physician for blood works or wound culture. Document the patient's instruction under the skilled intervention section of your visit note. Call the physician to verify the type of wound. I would like to introduce you to Charlie, my friend. He is going to be our model for today. Proper wound measurement as per Medicare standard is so important. To measure the wound, we have a sample form for you guys to see. To get a good measurement so that each and every nurses can have the same way of measuring, therefore you get the same size of your wound. The wound area approximation. Rectangular area as it is shown here, and the elliptical area as it is shown below. Assess and observe the circulation for wounds and extremities. Check for signs of poor circulation such as skin discoloration, change in skin temperature, increase in pain more than 3 seconds of capillary perfusion, or pedal pulse weak or absent. Documentation is to document assessment of skin discoloration and change in the skin temperature under your wound graft, if possible, under your wound graft. Obtain wound doctor or wound care center for any circulation studies done. We want to find out if this is, when we got the patient, this is normal for the patient, this is what the status of the patient is, so that we can determine for any changes. Document assessment of pain under pain assessment section on your nurse's visit note. Instruct patient on ways to promote circulation such as wearing a non-constricting clothing, elevating legs if not contraindicated, and not crossing legs. Make sure to document the capillary refill and the pedal pulses under the cardiovascular section of your visit note. Assess, observe comorbidities and risk factors affecting wound healing. Your intervention is to check the status of comorbidities such as diabetes, PVD, CAD, and neuropathy, and request for management if not being managed. Make sure to document status of comorbidities and risk factors under the skilled intervention on your visit note. Check risk factors such as incontinence, immobility, home environment, skin moisture, malnutrition, and dehydration. Provide the patient and caregivers teachings on keeping the wound area clean and dry, to use moisture barrier, turning every 2 hours if possible, and if the patient is bed-bound or chair-bound, considering friction, sharing, hand washing, cleanliness, and immediate patient environment, fluid and protein intake unless restricted. Document the need for pressure relief service under the coordination of plan, communication note, and physician order. You can also identify the need for pressure relief service. Just make sure to get an order from a physician. 4 is to identify if there is a wound care specialist or if the patient is being managed by a wound care clinic. If there is no wound care specialist or patient is not being seen in a wound care clinic, recommend to the physician and help make an arrangement for the patient. Document communication with physicians under coordination of plan, communication note, and physician's order. If order is obtained, communicate to the office for making an arrangement.